there are a lot of physicians on radio out of New York, and I listen to them sometimes, and it is all about nutrition sometimes, and vitamins and that sort of thing. But I think traditionalists think they're quacky.
Yeah.
Is that true?
That's true.
Yeah.
And we were once traditionalists. And I was one of the ones that was skipping over that vitamin D study because I knew that I was trained that that was going to help my patient. And that's the part that's very frustrating is that we were, and it's not, when I say we, I mean we as a group of physicians across the nation, we're all taught that way, to discount non-pharmaceutical approaches to care. And if you look around the world, anyone that's traveled anywhere else outside of the United States, the doctors don't just reach for pharmaceuticals in the first place. They look at the patient and they try to look at the evidence. And everything that we do is an evidence-based practice, and we're board certified to know the evidence.
But we are living longer because of drugs. I hate to use that word that way, but it's true. I mean, there are people
that... Well, it's been true.
Well, how about like people that have high blood pressure? A long time ago, they weren't really treated for it. They just had high blood pressure and that had a kind of a short life and, an occasional stroke or a heart attack. But now people are living longer.
Well, don't get me wrong. Yeah. There's no question that we need pharmaceuticals.
Right.
Absolutely, no doubt about it. As internal medicine doctors, that's supposed to be our specialty. You know? And absolutely, we use pharmaceuticals, but we don't reach for them first. Our prescription pad is no longer in our hand, cocked and ready.
True.
It's in our back pocket, and we pull it out when it's absolutely needed, and there's no other way. Because the majority of most illnesses, especially in internal medicine, can be treated with diet, lifestyle, emotional, and spiritual approach.
You're right about that too. Most of the things that I've learned about the importance of vitamin D and magnesium and all the other stuff, it's really from these radio guys. It's true.
Yeah.
It's true. I mean, you don't go to your normal physician. I have a very good doctor, of course, but they don't do that, really.
Right.
They don't have time to.
No.
How can they do that in a 10-minute visit or a 15-minute visit? The whole system is set up to drive a certain model of care, which is disease-based care.
Right.
And by the way, I do work at St. Mary. I'm one of the chief medical information officers.
You are.
I'm the chief medical information officer, which I also serve at Trinity Health. And, so I'm very fortunate I get to see these different perspectives as a provider, as an administrator, as a family member, because I have a huge family who pretty much all the time there's one person in the hospital. And so it's been really enlightening for me, and the integrative approach has been a wonderful part of my life, let alone my career.